Welcome back once again. And as we move ahead with the proceedings, in fact, it's our honor to introduce and invite on the dais Ms.Priya Kumar. She's Additional Director General, DD News. Ladies and gentlemen, please put your hands together. Ma'am is going to do a detailed presentation on role of public service broadcaster in crisis communication. Presenting before you, Ms. Priya Kumar, Additional Director General, DD News.
First slide. Good morning, everyone. Mr. Mayank Agarwal, CEO Prasar Bharati, Mr. Jawad Mutagi, Secretary General ABU, Deborah, friends, colleagues, esteemed delegates. I'm standing here today to do a small presentation on the role of the public broadcaster in times of crisis. I'm starting with a slide which I think everybody knows, so I will not go much in it, but I just wanted to put it in perspective that a crisis is an unpredictable event which has a perception which generates negative outcomes. Basically, a crisis has an immense human effect. It has, the impact is very big, and that is why it needs to be handled. And any handling of a crisis is incomplete, and it is critical that there has to be good communication to do it. And that's where the public service broadcaster comes in, because it has the resources, a large network presence, and can play a lead role. The types of crisis, they're, as we know, man-made, natural, sudden developments. It can also be through a policy initiative which may cause concern and may lead to a crisis. It also happens due to misinformation. A lot of misinformation is spread and people get anxious and a crisis may occur. In the new communication age, I think the crisis has become even more manifold, because the events which 10 years back nobody would notice, they may have been localized, are now known everywhere in a split of a second. No location of the world is remote, and individuals are connected 24 hours. In any public communication, first of all, we need to understand the crisis. What stage are we in? Are we going into a crisis? We have to plan communication accordingly. Are we into a crisis, full-blown crisis? Or are we dealing with the aftermath of the crisis? So that is the communication and the strategy which has to be decided for the stage that we are in. The communication has to be targeted. It has to be targeted to your viewer. Who are we addressing needs to be known. The platforms in which we are going to target our viewers and take out the communication and the information. The other thing which a lot of people have already talked about is countering fake news, because this is what happens in a crisis, that unless there's timely information, there is a news hole, and everybody just gets into it and starts spreading a lot of misinformation, and that is where it is very, very important that we counter this, and I think every speaker so far has mentioned that. And ultimately, the long-term success of communication is the public trust in the communicator and the communication. The role of a public service broadcaster. The stakeholders for a public service broadcaster are public at large, as well as the other media. It's a credible voice, and it has generally a very vast regional network and can take in a very short time the message across to a very large area. And of course, the communication strategy, as I already mentioned, should be focused on the stage we are in and who we are delivering it to. The primary objective is how to deal with it, the instructing information. The secondary objective would be psychological coping, because there's a lot of effect on the people. It could be physical, it could be psychological. And lastly, repairing the reputation, because it might lead to a situation where the credibility of an organization may be affected, and that is where we have to put out the positive news so that it does not happen. Prasar Bharati. It is a very vast network which covers this very big country. We have Doordarshan with its 36 satellite channels, 8 are national, 28 are regional. We have news channels. We have a DD News channel which is totally Hindi, and we have recently launched DD India, which is a completely English news channel, which is our face to the world. In fact, DD India has been working very effectively with some partner countries. We have MOUs signed with a few countries for content as well as distribution, and we are going ahead and making more collaborations so that we take the message of India to the world. Prasar Bharati communicates in a lot of regional languages. If I say only radio, it is 182 languages and dialects, and DD in 25 languages. So you can imagine the immense audience that we are serving and addressing. We have more than 900 correspondents and stringers stationed in every district of this country. I'm very glad to share that DD and AIR have been rated as the most trusted channels in India by the Reuters Institute in their Digital News Report 2022. So we have a lot of trust of the people, and that is where the expectation also comes in, which we need to fulfill. In any crisis, I think all governments like to put out critical messages, trusting and putting it out through the public broadcaster. We have, in natural disaster conditions, we have direct links with the authorities which are dealing with the disaster in terms of the information which has to flow, as well as the rescue and the relief operations, vital warnings. So we have direct links with them, and we get news absolutely on the dot when any crisis is brewing, in fact. We lead the information dissemination because, like I said, the governments like to communicate the beginning and the essential part of it through a public service broadcaster. We cover the policy makers, we cover the review meetings which are happening and the information flowing out of it, which also is disseminated widely through the media. We have continuously, it's not only during a crisis that we get active, we are continuously active because we realize that crisis will happen, all kinds of crises will happen, and so we have programs on a continuous basis. In fact, preparing people for different kinds of crisis, how to handle it, how to prevent it, which is a program called Aapda Ka Samna. It is facing a disaster, if I just translate it. And this is every 2 times in a month we have this program on different disasters, preparing the people. We have experts talking about it, and we have a lot of public audience for that. We have an extensive network of radio and ground level correspondents which we leverage, because radio, I think, is one of the most cost-effective means of communication in a country like ours, which has remote islands, which has the Himalayas, which people just can't reach. So radio is reaching places where others can't reach, and in a situation of a natural disaster, when there are damaged infrastructure where nothing else reaches, radio reaches. In fact, AIR, All India Radio, puts out special bulletins for fishermen in coastal areas when disasters warned, and there's a warning for a disaster. We have special bulletins for fishermen. In earthquakes, we have special disaster relief bulletins, because that is how we get the information across to the country where nothing else reaches. We have two-way communication. In fact, radio again, because that is how we reach in a situation where nobody else reaches. We have phone-in programs where people on the ground can talk to experts, find out how do we get out of this, what are we supposed to do. So AIR mounts such two-way live and phone-in programs also when there are times of natural disaster. If we see about 10, 15 years back, the kind of casualties we had in a natural disaster, maybe cyclones, earthquakes, and now what we have, because this is how we've evolved. We are technologically ready. We partner with government. And now, in the recent natural disasters, we've seen that the casualty is much less. And we are working with government and other media to reach a zero casualty target. In man-made crises, Ukraine war, Afghan crisis, Sri Lanka, we have talked about it. One of the speakers talked about it. And this is not only, like the world is so connected, it is not only happening there, it is having a big impact on us too, on our country too, because our citizens get stranded, there's a lot of concern here, and we have been in constant touch with the authorities in disseminating the advisories, the evacuation efforts of the government, the flight schedules, helpline numbers, and putting out this information to our public to ensure that this concern is addressed to an extent that, yes, things are happening. The impact in the other countries also we are disseminating, and what is the country's response to it, and what is the country's stand on it. We communicate that. We use all kinds of platforms, telecast, broadcast through radio, social media, every kind of platform is used so that we put out credible, well-informed, focused, and timely information. And then comes COVID-19. COVID-19, I think, has established that the public broadcaster is an important stakeholder in crisis management. Here was a crisis which nobody knew about it, nobody understood it, it was unexpected, it was unknown, and as it was happening, we were learning. There was nobody had any knowledge of what to expect next. It was very prolonged, it was widespread. So here, the communication had to be very dynamic. We had to be in an explanatory mode, because to explain what's happening, there were medical terms, very complex medical terms which had to be conveyed. There was a lot of behavior change expected. We had to tell them what to do, what not to do. We all had to be informed. It was two-way because their questions needed to be answered. And of course, countering all the misinformation that was happening at that point of time. And again, the role of the public broadcaster, because it was the repository of public faith, and nobody else really knew what was happening. And I think it was not only in India, it was across the world. I'm sure all of you here would have done similar things in your countries, because it was across the world that the public service broadcaster was playing a very vital role. Governments were using this platform to communicate to the public, put out the daily press briefings, what is happening, the policy decisions, the action that the government was taking. All that was put out in India through us, and I'm sure in other countries also, through the public service broadcaster. We brought the nation together, I would say, because it was, everybody was learning at the same time, and there was a lot of action happening on the ground. The civil society was into action. They were helping each other. There were stories there to be covered, so that there were shared experiences. We covered the stories from the ground, how people were coping with it, how people were helping each other out, the positive stories, so that this concern and this anxiety could be lessened. And we played a major role in tackling fake news. As CEO sir mentioned, that there was a fact-check unit in PIB. We worked very closely, and we ensured that the information was on the dot and fast flowing out to counter the fake news. Our objectives was disseminating correct, timely information, encouraging COVID-19 appropriate behavior, addressing vaccine hesitancy, because when the vaccine came in, there was a lot of doubt, what it will do, will it be affected, will it harm us? So this is, we did a lot of work on that. We went to our ground level workers were going into remote areas, trying to vaccinate people. We would get stories out of them. Your own local people would be saying, I'm perfectly all right. We have had this vaccine and there's nothing to fear about it. Those kind of stories we covered from the ground. We busted with the myths. We motivated the frontline worker, because COVID was a lot of action by the frontline worker, the medical people, the ambulance drivers, the nurses, the police, the journalists. These were all frontline workers. And we mounted a special series called the COVID Warrior, so that just to keep the morale up also, and to recognize the efforts that they were putting in into this kind of a crisis, which everybody was so scared of. We had interactive and inclusive communication. We ensured that we had programs and information put out in sign language for the hearing impaired, for instance. We were communicating in a different way to a rural audience, because we had to speak in a manner that they would understand. So we had different kind of communication going out for different audience that we were targeting. And building confidence, reducing panic, because we were also bringing the action being taken by the government. There was, we were bringing out health ministry briefings. We were, in fact, also bringing out all the action in terms of the medical infrastructure that was being put in place by the government, the oxygen expresses that were run, special trains were run, special hospitals were made. So just to bring that confidence that, yes, you are not alone and things are happening and you will be taken care of. So these are some of the things that we did, like I said. And we did state-specific information dissemination, because the network of a public sector broadcaster is such that we are present in the length and breadth of the country. We could speak to people in their own language. We could get the doctors. We had a two-way communication where we had programs with doctors sitting on our panel. We had phone calls from very remote areas talking, people who just did not understand it. And there was the doctor telling in their own language and counseling them. So this kind of communication we did. We targeted any particular state which was seeing a lot of cases. We would target that in a different way. So we were strategizing continuously and ensuring that the right information goes to the right people in the right language. We highlighted government initiatives. And in fact, not only were we talking to the public and addressing their concerns, we had a lot of concerns. Because, like again, CEO sir had mentioned, that in the beginning when our people started falling sick, we had to change the entire programming. We had to we made small groups which would work. And we made different groups so that if one group gets affected, we were immediately ready with another group taking its place. So we had to do that kind of an administrative and programming change. We suddenly overnight had to shift to another place to do our transmission, which was not as equipped. So you can just imagine there we were trying very hard to get the transmission going, and we did. But it was a tough time, and I suppose it was a tough time for everybody. Some highlights, DD News ran a Mask Up India campaign. We were everywhere. We had on every channel. We would talk about, it included this logo, and we had explanatory news capsules, infographics out on our social media. We had our news anchors wearing masks so that people understood the gravity of the situation and realized that that is very important. We had special health programs I've already mentioned. We had promos on vaccination. We had special creatives. And we had targeted special programs. We didn't forget the kids also. We had a special program called Kids Time because we had to communicate to the children too who were locked up in a lockdown situation. So we had a special program for them too so that they also understood the gravity. And at the same time, we kept them entertained during that Kids Time so that they didn't go out. In conclusion, I'll just say that the public sector broadcaster has a very important critical role. We are important stakeholders with the government, with the media. We have extensive network and reach, and that it is the trust factor which puts us in a very, very responsible position. So I would just say that the public sector broadcaster has to be there in any crisis communication. Thank you so much. Thank you.